3 months after solving the child trafficking case, I thought I deserved a break. I was wrong. The callback came at 7 a.m. on a Friday morning would drag me into the darkest corners of the medical world, where trusted doctors become monsters and beauty becomes a weapon. I'm Emma Richardson, and this is how I exposed Dr. Marcus Sterling, the plastic surgeon who deliberately destroyed his patients' lives for money. The voice on the phone was barely recognizable. "Emma, it's Victoria. I need your help. My best friend Victoria had been my rock through every case, every dangerous situation." Now, she was crying so hard I could barely understand her words. Something went wrong with my surgery. Something terrible. I was at Ocean City General Hospital within 20 minutes, my heart pounding with fear about what I might find. Victoria was in room 314, her face wrapped in bandages, her eyes swollen shut. When she tried to speak, her words were slurred and painful. The surgery was supposed to be simple, she whispered, just a nose job. But when I woke up, she couldn't finish the sentence. The nurse who'd been changing her bandages looked away, unable to meet my eyes. Dr. Sterling said there were complications. Victoria continued. "But Emma, I think he did this on purpose." "What do you mean on purpose?" I asked, though a chill was already running down my spine. The anesthesiologist said something strange before I went under. He said I'm sorry and looked like he wanted to warn me about something. And Dr. Sterling the way he looked at me right before the surgery. Like he was enjoying something. Victoria's voice cracked. "Emma, I've seen the preliminary results. My face it's ruined, completely destroyed." I held Victoria's hand as gently as I could. "We're going to figure this out. I'm going to find out what really happened in that operating room, but how? It's my word against a respected plastic surgeon. Who's going to believe me?" You'd be surprised what people will believe when you show them the right evidence. That afternoon, I began researching Dr. Marcus Sterling. On the surface, he appeared to be Ocean City's most successful plastic surgeon. Sterling Cosmetic Surgery had a gleaming website filled with before and after photos of satisfied patients. Dr. Sterling himself was featured in local magazines as one of the city's most eligible bachelors and respected medical professionals. But as I dug deeper, I started finding cracks in the perfect facade. Several former patients had filed complaints with the medical board, but all had been dismissed due to lack of evidence. The complaints followed a disturbing pattern. Each patient had gone in for routine procedures, nose jobs, breast augmentations, tummy tucks. Each had experienced unexpected complications that left them worse than before. And each had been told by Dr. Sterling that their results were due to rare reactions or healing problems, not surgical errors. But when I looked at the medical records, a different picture emerged. The complications weren't random, they were deliberate. I called my private investigator friend Jack Riley. "Jack, I need you to look into a plastic surgeon named Marcus Sterling. Something's not right about his practice, medical malpractice case, possibly worse. I think he might be sabotaging his patients intentionally." There was a long pause. "Emma, that's a serious accusation. You better have solid evidence before you go down that road. I'm working on it. Can you dig up whatever you can find about his background?" I called my private investigator friend Jack Riley. "Jack, I need you to look into a plastic surgeon named Marcus Sterling. Something's not right about his practice, medical malpractice case, possibly worse. I think he might be sabotaging his patients intentionally." There was a long pause. "Emma, that's a serious accusation. You better have solid evidence before you go down that road. I'm working on it. Can you dig up whatever you can find about his background? Financial records, previous employment, any complaints or lawsuits, everything, and Jack, be discreet. If I'm right about this, Sterling has a lot to lose." That evening, I visited Victoria again. The bandages had been removed from her eyes, and I could see the full extent of the damage. Her nose had been deliberately overcorrected, leaving her with difficulty breathing. Worse, there appeared to be intentional scarring around her nostrils that would never heal properly. Victoria, I need to ask you some difficult questions about the surgery. Do you remember anything unusual about the consultation or the procedure itself? She thought for a moment. Dr. Sterling asked a lot of questions about my insurance coverage. More than seemed normal for a cosmetic procedure. And he insisted on doing additional work that I hadn't requested, said it would be complimentary since I was already under anesthesia. What kind of additional work? He said he wanted to adjust my septum to improve my breathing, but I'd never had breathing problems before. And he mentioned doing some minor work around my eyes that would enhance the overall result. I didn't want the extra procedures, but he was very persuasive. This was starting to make sense. If Sterling was billing insurance companies for medically necessary procedures while actually performing cosmetic damage, he could collect money from both the patient and the insurance. The next day, Jack called with disturbing news. Emma, I found something interesting about Dr. Sterling's finances. He's been making regular large deposits into offshore accounts, way more money than his practice should be generating. How much money are we talking about? Over the past 2 years, nearly $3 million. That's impossible from plastic surgery alone. Even in a successful practice, that's what I thought. But here's the really interesting part. Sterling's been getting payments from Oceanic Insurance Company, the same company that covers most of the complications from his surgeries. It looks like he's double billing them for procedures, then getting kickbacks for creating repeat customers who need additional corrective surgeries. The scope of the fraud was staggering. Sterling wasn't just hurting patients for money, he was running an elaborate insurance scam that required him to deliberately botch surgeries. I decided to go undercover to gather evidence. I made an appointment for a consultation at Sterling Cosmetic Surgery using a fake name and claiming I wanted a breast augmentation. The office was exactly what you'd expect from a high-end cosmetic surgery practice: marble floors, expensive artwork, beautiful receptionists. But there was something cold about the atmosphere, something that felt more like a business than a medical practice. Dr. Sterling was a handsome man in his 40s with perfect teeth and an unsettling smile. During our consultation, he was charming and professional, but I noticed the same pattern Victoria had described. He asked detailed questions about my insurance coverage and suggested additional procedures I hadn't requested. While we're enhancing your chest, we might as well address that slight asymmetry in your facial structure, he said, pointing to features I'd never noticed. It would be a shame to miss the opportunity to perfect your overall look. When I hesitated, his demeanor changed slightly. Of course, if you're not serious about achieving your best possible results, perhaps you should consider a different surgeon. The manipulation was subtle but clear. Agree to the additional procedures or find someone else. I scheduled the surgery for the following week, knowing I would never actually go through with it. But the appointment gave me access to the office and allowed me to plant a small recording device in the consultation room. Over the next few days, Jack and I monitored the recordings and discovered disturbing conversations between Dr. Sterling and his staff. The Morrison woman is scheduled for Thursday. I heard Sterling say to someone, "Make sure you code it as a deviated septum repair. Insurance will cover the full amount, and we can bill her separately for the cosmetic work." "What about the complications?" the other voice asked, same as always. "Create enough damage to require at least 2 follow-up surgeries. The more procedures, the more we collect." My blood ran cold. They were discussing other patients' surgeries like they were planning a robbery. I had enough evidence to go to the police, but I wanted to catch Sterling in the act. I decided to attend my scheduled surgery appointment wearing a hidden camera. The morning of the fake surgery, I arrived at Sterling's office with butterflies in my stomach. I knew the risks. If Sterling discovered I was recording him, there was no telling what he might do. But I also knew that without video evidence of his methods, it would be difficult to prove the systematic nature of his crimes. I was led to a preoperative room where a nurse began preparing me for surgery. "Miss Johnson, Dr. Sterling wants to review your procedure one more time before we begin," the nurse said. When Sterling entered the room, I noticed his demeanor was different from our consultation. He seemed more clinical, less concern with charm. I've decided to make a few adjustments to your procedure, he said, making notes on my chart. We'll need to create some strategic scarring to ensure proper healing. Don't worry, you won't feel anything during the process. Strategic scarring, he was telling me exactly how he planned to sabotage the surgery, confident that I would be unconscious and unable to remember his words. Dr. Sterling, I'm having second thoughts about the surgery, I said, sitting up on the examination table. I think I want to postpone, his expression hardened. Miss Johnson, you've already been given the preoperative medications. It's not safe to stop the procedure now. That was a lie. I hadn't been given any medications yet. But Sterling was clearly trying to pressure me into going through with the surgery. I really think I should wait, I insisted, standing up. Please prepare my discharge paperwork. I'm afraid I can't allow you to leave in your current condition, Sterling said, motioning to the nurse. Prepare the sedative. Ms. Johnson is experiencing preoperative anxiety. They were trying to force me into surgery against my will. I backed toward the door. My hidden camera is still recording. I'm leaving now. If you try to stop me, I'll call the police. Sterling's mask completely dropped. You don't understand the situation you're in. Ms. Johnson, you've seen too much, learned too much about our procedures. I can't let you walk out of here. The nurse had produced a syringe and was approaching me slowly. Don't make this more difficult than it needs to be. I ran for the door, but Sterling blocked my path. Sedate her, he ordered the nurse. We'll say she had a violent reaction to the premedication, but before the nurse could inject me, I heard shouting in the hallway. Police, everyone freeze. Jack had been monitoring my camera feed remotely and called for backup when he saw what was happening. Officers burst into the room just as Sterling and the nurse were restraining me. Dr. Marcus Sterling, you're under arrest for assault, attempted battery, and conspiracy to commit insurance fraud, Detective Kim announced as she cuffed the doctor. You have the right to remain silent. The nurse was also arrested, along with 2 other staff members who were found destroying patient records in the back office. As they led Sterling away, he looked at me with pure hatred. You have no idea what you've just destroyed, he said. The investigation that followed revealed the full scope of Sterling's crimes. Over 5 years, he had deliberately botched more than 200 surgeries, collecting money from both patients and insurance companies while causing permanent disfigurement to innocent people seeking cosmetic improvements. The medical board immediately revoked his license, and he was facing federal charges for mail fraud, wire fraud, and conspiracy. Victoria's case became the centerpiece of a class action lawsuit against Sterling and his practice. With the evidence I'd gathered, we were able to prove that her disfigurement was intentional and part of a larger criminal conspiracy. The insurance companies that had unknowingly participated in Sterling's fraud agreed to pay for corrective surgeries for all his victims. Victoria underwent 3 additional procedures by a qualified surgeon and eventually recovered most of her original appearance. Emma, I don't know how to thank you, Victoria said 6 months later. Her face finally healed. You could have been seriously hurt trying to expose him. You're my best friend, I replied. I wasn't going to let him get away with what he did to you, but it was more than just about me, wasn't it? She was right. By the time Sterling was sentenced to 15 years in federal prison, we had identified over 200 victims of his scheme. Many of them were women like Victoria, young, trusting, and seeking minor cosmetic improvements. Sterling had targeted them specifically because they were less likely to question his medical judgment and more likely to blame themselves for complications. The psychological damage he'd caused was often worse than the physical disfigurement. As I reflected on the case, I realized how much trust we place in medical professionals. We go to doctors believing they want to heal us, never imagining that some might see us as nothing more than a source of income. Sterling's victims had paid him to hurt them, never knowing they were funding their own destruction. The case taught me that evil can hide behind any profession, even those supposedly dedicated to helping others. The Sterling case also led to broader reforms in medical oversight and insurance fraud detection. New protocols were put in place to identify patterns of unusual complications and to verify the medical necessity of procedures. It wasn't enough to bring back the confidence and appearance that Sterling had stolen from his victims, but it might prevent future patients from suffering the same fate.